Hello, I'm Dr. Daniel from Montreal. So the goal of the video today is to understand how we can increase the girth of the penis. We have basically two techniques to increase the girth of the penis. The first one is to inject hyaluronic acid, the same kind of acid that we're injecting in the lips, in the cheek for women. We use the more cohesive acid, and this will be the purpose of another short film. The second one, and the most widely used one, is the fat grafting technique. Fat grafting is a pretty simple technique. The principle is to harvest fat in the belly, in the thigh, to prepare the fat in order to purify the fat, so we can separate the blood cells from the adipocyte, and then to inject the fat in the right place, in the right plane. To purify the fat, after harvesting the fat via classic liposuction, microair liposuction, we are taking back the fat and we will prepare it. So the preparation will be first to try to eliminate all the water we inject to do the liposuction. Then we will centrifugate the fat, 5,000 spin per minute for 5 minutes. This will separate the adipocyte from a oily substance and the blood cells. We will keep only the adipocyte. Then we will prepare the fat doing the nano grafting technique. So we will emulsify the fat, going back and forth in 2 syringes. This will prepare the fat for injection. The injection will be done with a small blunt cannula via a very small incision, 20 centimeters to the organ. Then we will make a deposit of the fat from distal to proximal in all the plane over the dartos, which is one of the membranes around the penis. Usually, out of this fat, 70% will take in the new place. So we will lose 30 to 40% of the fat we injected. Are we overcorrected? No. At the beginning we were overcorrected, but for some people the resorption is way less than 30%. So we try to put the right amount during the surgery, and then we see if we need a second touch. It's always easier to put back some fat than to remove some fat. The main drawback of the technique, it's a natural technique. This is the beauty of it. There is no silicone, there is no piece of plastic, there is no implant. It's a natural technique, it's a graft. It's also the major drawback of the technique. As it's natural, like hair graft, like skin graft, it can take or not take. So you can have some irregularities on the surface of the penis. This can be corrected by a second injection. You can have also some rejection, locally rejection of fat, which will form some granuloma, kind of cyst. It's benign cyst. Most of the time, patient accept them, but sometimes we have to remove them or to fragmentate them.
Thank you for watching. Please like and subscribe and comment your suggestions.